Rational Emotive Behavioral Therapy.
A very good morning to my dear beloved sir. My name is Joanna Priti Narayanasamy. My ID number is DEM04200017. Today I would like to present about this theory is by whom. Rational Emotive Behavior Therapy, rebate, is a type of therapy introduced by Albert Ellis in the 1950s. He was born in 1913 into a Jewish family in Big Bush, but spent most of his life in New York City. After literary efforts proved unsuccessful, he decided to study psychology. After that, he wanted to become a psychological clinic psychologist, but he became frustrated that only medical professionals were admitted. Finally, he began to practice his own theory in 1955 and established the Albert Ellis Institute to promote rebates. That's all from me, sir. Thank you for listening. Have a nice day, sir. Thank you, sir.
Good morning. My name is Deepan, son of Iswar, and my ID is DEM05200077 from batch 21. Today I am going to present about what is rational emotional behavior therapy. Rational emotive behavior therapy, formerly called rational therapy and rational emotive therapy, is psychologically and empirically based. Directive active psychotherapy aims at resolving emotional and behavior problem and disorder and helping people achieve more fulfilling, happy, and live to more satisfying life. In rational emotive behavior therapy framework assumes that people have both initial and rational, self-helpful, social helpful, and constructive, and irrational. Self-destructive social tendencies and helpful tendencies as inequally wrapped contingents that to large extent people consciously and unconsciously construct emotional difficulties such as self-blame, self-pity, clinical anger, grief, guilt, shame, depression, and anxiety, as well as behavior and behavior tendencies such as projection compulsory, avoidance, addiction, and withdrawal through their relational and self-trafficking emotions and behavior. Rational emotive behavior therapy is then employed as an educational process in which two therapists often actively teaches the client to identify rational and self-referring belief and psychology they are in agree. Extreme, unrealistic, illogic, and absolutic then question and accept them, deny them rigorously and actively, and replace them with more rational and self-awareness. Using various cognitive, emotional, and behavior methods and activities along with the therapist, help homework and client and can achieve a more rational, self-helping, and constructive way of thinking. A fundamental premise of rational emotive behavior therapy is that people are emotionally but by how they construct their views of those cases through their figures, every belief, meaning, and psychology about themselves and others. This concept has been attributed to the Sophic philosopher Epictetus, who is often cited as using similar ideas and integrity.
Good evening, sir and dear friends. Thank you for being here today. I'm Emoshni Gunalan, an enforcement student from Newton International College. I'm here today to talk to you about what is the concept of rational emotive behavior therapy of the theory. Elemental to rational emotive behavior therapy is the concept that our emotional result exclusively from our belief, not from the event that happen in our lives. Thus, it is one of the idea important of our thoughts to be healthy and rational because the outcome of this belief will be the emotional growth and happiness. If our thoughts are unreasonable and self-defeating, our passionate life is sorrow from neuroses such as self-blame, sadness, and fear. Hence, rational emotive behavior therapy is an educational procedure in which the therapist leads the client on how to identify irrational beliefs, discuss them, and replace them with rational ones once the client is prepared with healthy beliefs. Emotional difficulties and problematic behavior are abated. For example, activating the client event, be a young man being distressed by his girlfriend. After that, the B convey a belief that assume over that causes the emotional effect described by the C. The key to rational emotive behavior therapy considered is that the belief, not the activating the event, induce the emotional impact. Accordingly, if a person has many irrational beliefs, then he or she is likely to experience much emotional pain throughout life as various challenges are encountered. However, rational emotive behavior therapy (REBT) instructs that we know some of them from other people during our childhood and the rest we conceive on our own out of we conceive on our own. That is the only way in which the past issues in rational emotive behavior therapy, our current beliefs are learned from past experience. We cannot change the past while REBT, that means rational emotive behavior therapy, set less focus on discussing it. Rather, rational emotive behavior therapy works to replace on illogical belief with logical ones. Rational emotive behavior therapy thought irrational thoughts are the reason for human neurosis, including depression and strain. Thus, irrational thoughts tend to forget the positive, magnify the negative, distort reality, and generalize. Yet, rational emotive behavior therapy conducts that people tend to overuse should, must, oughts. Subsequently, many of these self-defeating thoughts are imbued in early life and accent stronger as a person constantly revalidates them. The effect of irrational beliefs can be gently flattered as likely procrastination, but can also be exceedingly disruptive, immobilizing, or even destructive. Two irrational thoughts will be frequently be prominent in how people speak to themselves. Gradually, rational thoughts are assumably exist as instinctive involuntary attitudes or extreme evaluated psychological schemas about which people are not acquainted, which is affected from the fundamental language the mass. Further, rational emotive behavior therapy leads the absolute self acceptance is one of the expectational significance in encouraging wellness. Nevertheless, healthy people can understand that they are not perfect and will continue to make mistakes, but see themselves as helpful. Moreover, reflecting the ABC theory of personality, successful rational emotive behavior therapy at step DEF. The D stand for argue. The therapist enable the client to inquire about the irrational belief B. Then the result of arguing the defeating belief and replacing it with a rational one proceeds an effective philosophy E, and also a new set of feeling F that not be debilitating. All thought rational emotive behavior therapy guides that the counselor should be display unconditional full acceptance. The therapy is not inspired to build a warm and caring relationship with the client. Finally, a successful partnership between the rational emotive behavior therapist and a client result in changes to the client's cognitions, which result in the client feeling better. Self-defeating thoughts are control and behavioral changes result. The client advances towards self-acceptance despite his or her fault. I really appreciate that you took the time to be here and listen to my presentation. Thank you so much.
Hi sir, have a nice day. My name is Manita K7, ID DEM 05200040-21. Today I would like to present about the what are technique used with REBT theory. So what is REBT? REBT is rational emotive behavior therapy. Alice recommends a selectively eclectic approach to therapy. Use strategic intouchably is no systematic way, but according to the need of the hour. Following are the strategies that are common in use as the name suggests it include cognitive technique, emotive technique, and behavior techniques. Firstly, I would like to tell about the cognitive technique. Cognitive technique aim at teaching client how to deal with self-statement so that they no longer believe them and encourage them to acquire a philosophy based on reality. In this, rational analysis is the first step in REBT, analysis of specific episodes to teach the client how to uncover and dispute irrational beliefs. These are usually done in session at first, then as the client get idea, they can be done as homework. Next, disputing irrational belief. It is actively disputing client irrational belief and teaching them how to do this challenging on their own client. Go over article should until they longer hold that irrational belief or at least until it is diminished in strength. Disputing with irrational belief can be done both by the therapist and the client. Then change one's language in RBT contents that imprecise language is one of the cause of distorted thinking process. Clients learn that should can be replaced by preferences. After that, reframing is another strategy for the getting bad events into perspective is to re-evaluate them as uncomfortable rather than as harmful. A variation of reframing is to have the client see that even negative even almost always have a positive side to them. Secondly, I would like to tell about the emotive technique. Emotive technique help the clients to understand the value of unconditional self-acceptance and unconditional other acceptance. Even though the behavior may be difficult to accept, they can be decide to see themselves and others as worthwhile. In this, rational emotive imaginary is the first step in REBT form of intense mental practice designed to establish new emotional patterns by making the clients imagine themselves the worst thing that could happen, unhealthy and upset feelings, intense experience of feelings, and changing them to healthy and positive feeling. As clients changing their feelings about adversities, they stand a better chance of changing their behavior in the real situation. Next, role playing is both emotional and behavior components. Clients can rehearse certain behavior to bring out what they feel in situation with the therapist in a presumed environment. The focus is on working through the underlying irrational beliefs that are related to unpleasant feeling. After that, shame attacking exercise is Alice has developed exercise to help people reduce shame or behaving in certain ways. When we stubbornly refuse to feel ashamed by telling ourselves that is not catastrophic, is someone think we are foolish. The exercises are aimed at increasing self-acceptance and mature responsibility. Then use of force and vigor is way to help client to go from intellectual to emotional insight. Clients are shown how to conduct forceful dialogue by reverse role playing, in which therapists adapt the client belief and vigorously argue for it, while the client tries to convince the therapist that the belief is dysfunctional. It is especially useful when the client now see the irrationality of a belief but needs help to consolidate that understanding. Thirdly, behavior technique are one of the best way to check out and modify a belief by act. Clients can be encouraged to check out the evidence for their fears and to act in ways that disprove them. The common techniques are exposure, risk taking, paradoxical behavior, and postponing gratification. In this, exposure is the first step in RBT, possibly the most common behavior strategy used in RBT involve client entering fear situation they would normally avoid. Such exposure is deliberate planned and carried out using cognitive and other coping skills. Next, risk tasking is purposed to challenge belief that certain behaviors are too dangerous to risk when reasons why that the outcome is not guaranteed they are worth the chance. Then paradoxical behavior is when a client wishes to change a dysfunctional tendency, encourage them to deliberately behave in a way contrary to the tendency. Emphasize the importance of not quitting until they feel like doing it, practicing the new behavior even though it is not spontaneous will gradually internalize the new habit. After that, postponing gratification is commonly used to combat low frustration tolerance by deliberately delaying smoking, eating sweets as alcohol, and sexual activity. That's all for me, sir. Thank you.
Hi, I'm Tradimian here. My ID number is DM052017. So my part is conclusion. So here we go. The goal of this essay was to highlight three major topics that will help people better understand irrational beliefs and rational emotive behavioral therapy in sports with the focus on mental wellness. This article raised a number of research problems, irrational and reasonable ideas, and mental health. Furthermore, the application of REBT should be publicized more regularly in primary research and case study sources so that a shared understanding of REBT can be implemented in sports can be gained. In overall, it is hoped that this paper will pick the interest of academics, students, and practitioners, resulting in a greater understanding and acceptance of REBT significance in the promotion of the mental health in sports. Thank you.
Thank you, sir, for listening and watching our presentation.